Infective endocarditis is a serious heart condition that every medical student needs to understand. It is an infection of the inner lining of the heart, including the heart valves. This infection can have serious consequences if not diagnosed and treated promptly. As future healthcare providers, medical students must be well versed in the complexities of infective endocarditis to effectively diagnose, manage, and treat this potentially life-threatening condition. This essay will provide a comprehensive overview of infective endocarditis. We will delve into its causes, explore the criteria for diagnosis, and outline the typical signs and symptoms. We will also discuss the importance of prompt diagnosis and treatment, including the various treatment options available. Lastly, we will emphasize the significance of prophylaxis in preventing this serious condition. By understanding infective endocarditis, medical students can be better equipped to provide optimal care for their patients in the future. This knowledge is crucial for making informed decisions and potentially saving lives. Let's begin our journey into the intricacies of infective endocarditis. Infective endocarditis occurs when bacteria or other microorganisms enter the bloodstream and infect the heart's inner lining, particularly the heart valves. This infection can lead to inflammation, damage to the heart valves, and the formation of vegetations, which are clumps of bacteria, blood clots, and cellular debris. The most common cause of infective endocarditis is bacteria, particularly Streptococcus and Staphylococcus species. These bacteria can enter the bloodstream through various means, such as dental procedures, intravenous drug use, and even minor cuts or infections. Other, less common causes include fungi and certain medical devices like catheters. Infective endocarditis is broadly classified into two types, acute and subacute. Acute infective endocarditis progresses rapidly and severely, often with a sudden onset of symptoms. In contrast, subacute infective endocarditis develops gradually over weeks or even months, with more subtle and insidious symptoms. Understanding the different types of infective endocarditis is crucial for determining the appropriate course of treatment. Diagnosing infective endocarditis can be challenging, as its symptoms often mimic other conditions. The Duke criteria are a set of clinical guidelines used to help diagnose infective endocarditis. These criteria are based on a combination of clinical findings, laboratory tests, and echocardiographic evidence. The Duke criteria include major and minor criteria. Major criteria include positive blood cultures, evidence of endocardial involvement on echocardiography, and the presence of a new regurgitant murmur. Minor criteria include predisposing heart conditions, fever, vascular phenomena, and immunological abnormalities. A diagnosis of infective endocarditis is considered definite if two major criteria, one major and three minor criteria, or five minor criteria are met. Possible infective endocarditis is considered if one major and one minor criterion or three minor criteria are met. This systematic approach using the Duke criteria helps clinicians make a more accurate diagnosis of infective endocarditis. The signs and symptoms of infective endocarditis can vary depending on the individual and the type of infection. However, certain clinical manifestations are suggestive of the condition. The From Jane mnemonic is a helpful tool for remembering the common signs and symptoms. Fever. A persistent low-grade fever is a common symptom, often accompanied by chills and sweats. Roth's spots. These are small, painless, reddish spots on the palms of the hands or soles of the feet. Osler's nodes. These are painful tender nodules on the pads of the fingers or toes. Murmur. A new heart murmur, or a change in an existing murmur may indicate valve damage. Janeway lesions. These are painless, flat, reddish lesions on the palms of the hands or soles of the feet. Anemia. A decrease in red blood cells can occur due to chronic inflammation. Nail hemorrhages. Splinter hemorrhages, which are tiny blood clots under the fingernails, can be a sign. Emboli. Fragments of the vegetations can break off and travel to other parts of the body, causing complications like stroke or organ damage. Recognizing these signs and symptoms is crucial for early detection and prompt treatment of infective endocarditis. Section 5. The importance of prompt diagnosis and treatment. Infective endocarditis is a serious condition that can be fatal if not treated promptly. Early diagnosis and treatment are essential to improve outcomes and reduce the risk of complications. Delays in diagnosis can lead to heart valve damage, heart failure, stroke, and even death. When infective endocarditis is suspected, prompt medical attention is crucial. Early initiation of appropriate antibiotics is vital to eradicate the infection and prevent its spread. The choice of antibiotics depends on the specific bacteria causing the infection, and blood cultures are often necessary to identify the culprit. In addition to antibiotics, other supportive measures may be necessary, such as bed rest and intravenous fluids. Close monitoring of the patient's condition is crucial to ensure treatment effectiveness and manage any potential complications. The importance of prompt diagnosis and treatment cannot be overstated, as it can be the difference between life and death for patients with infective endocarditis. Section 6. Treatment strategies for infective endocarditis. The cornerstone of infective endocarditis treatment is prolonged intravenous antibiotic therapy. The specific antibiotics used depend on the type of bacteria causing the infection, as determined by blood cultures. Typically, a combination of antibiotics is used to effectively eradicate the bacteria. Intravenous antibiotics are usually administered for 4 to 6 weeks to ensure complete eradication of the infection. In some cases, a peripherally inserted central catheter, or PCC line, may be placed to facilitate long-term intravenous antibiotic administration. Patients may receive intravenous antibiotics in the hospital or at home, depending on the severity of their condition and their response to treatment. In addition to antibiotics, surgery may be necessary in some cases of infective endocarditis. Surgery is often considered if the infection is causing severe heart valve damage, if there are large vegetations that pose a risk of embolization, or if antibiotic therapy alone is ineffective. Surgical interventions may include valve repair or replacement, drainage of abscesses, or removal of infected tissue. Section 7. Prophylaxis, preventing infective endocarditis. Prophylaxis, which involves taking antibiotics before certain dental or surgical procedures, is recommended for individuals at high risk of developing infective endocarditis. This preventive measure aims to reduce the risk of bacteria entering the bloodstream and causing an infection of the heart valves. Individuals who may require antibiotic prophylaxis include those with artificial heart valves, a history of infective endocarditis, certain congenital heart defects, and heart transplants with abnormal heart valves. The American Heart Association, or AHA, provides specific guidelines on who should receive antibiotic prophylaxis and for which procedures. The recommended antibiotics for prophylaxis typically include amoxicillin, ampicillin, or clindamycin, taken 1 hour before the procedure. It's important to note that antibiotic prophylaxis is not recommended for everyone undergoing dental or surgical procedures. Discussing the need for prophylaxis with a healthcare provider is crucial to determine individual risk factors and the appropriate course of action. Section 8. Conclusion: the enduring relevance of infective endocarditis. Infective endocarditis remains a significant health concern, demanding a comprehensive understanding from healthcare providers, particularly medical students. This serious heart condition, if left untreated, can lead to severe complications and even death. By grasping the intricacies of infective endocarditis, including its causes, diagnostic criteria, clinical manifestations, treatment modalities, and preventive measures, medical students can confidently face this challenging condition. Their knowledge will empower them to make well-informed decisions, provide timely interventions, and ultimately improve patient outcomes. As future physicians, their dedication to understanding infective endocarditis is crucial in the ongoing fight against this potentially devastating disease. Through continuous learning and a commitment to excellence in patient care, medical students can contribute significantly to the field of medicine and make a lasting impact on the lives of their patients.